So this is the summary of anti-malarial drugs. So indications, when to use these drugs. It can be used for prophylaxis and for treatment. Let's look at prophylaxis first. You have two major drugs, chloroquine and Mefloquine. These two drugs are weekly drugs, very effective to used as prophylactic agents. And also Primaquine also effective to used as a prophylactic agent, but commonly used is chloroquine, but most commonly used in United States is Mefloquine. Okay, and these three are weekly prophylactic agents. But daily drugs are Atovaquine-proguanil and another drug, doxycycline. Doxycycline is effective also to prevent Lyme disease. Therefore, if a patient is going to hike and if there is a risk for tick bites, and to protect both malaria and that, it can be useful. But keep in mind, doxycycline cannot be used to treat malaria because it is not effective to kill all the parasites. So if a patient comes with malaria, you should pick any other drugs, not this doxycycline. So I will mention that how to treat. Okay, so prophylactic agent we discussed. Now treatment. So the other listed drugs are not for prophylaxis. Okay, treatment, there are two types. You have disease, patients comes with a disease or a relapse. Okay, so disease, that is malarial disease, if a patient comes with, you need to ask a question, is it complicated or uncomplicated? If a patient comes with a complicated malaria, CDC's first recommendation is Artesunate, very fast acting drug, well tolerated drug, very effective to kill all the parasites, therefore all the species, therefore Artesunate is the primary choice. Or if it is not available, you can give quinine. Quinine is also effective. In pregnant patients, Artesunate has a high risk, therefore quinine is preferred in pregnant patients. Then, okay, so the complicated malaria you can treat with either of these drugs. Then move to the uncomplicated malaria. In uncomplicated, you need to ask, is it falciparum or non-falciparum malaria? So let's look at the outpatient falciparum malaria. If a patient comes with a falciparum malaria, or the patient traveled or coming back from a falciparum risky country, in that time you give artemether lumefantrine. The lumefantrine, this drug actually is very effective to treat this drug combination is very effective to treat the falciparum malaria. Okay, so what about non-falciparum? Chloroquine, Mefloquine, or either of that. So chloroquine has more resistance, therefore Mefloquine can be given. But if it is chloroquine-sensitive, if a patient traveling to Mexico or some, you can give chloroquine. But if it is a chloroquine-resistant area, you can give Mefloquine. So non-falciparum malaria can be treated with these two drugs. Or third drug is Atovaquine-proguanil. These drugs can be used to treat that. Okay, very good. Now, after treating, if it is non-falciparum, if it is specifically P. vivax or P. ovale, there is a risk of relapse. That means these parasites can hide inside the patient's liver hepatocytes as hypnozoites. Therefore, we need anti-relapse agents. There is only one drug. There are two drugs actually. Primaquine is the typical drug. Board like to ask general questions, so they give only Primaquine. Primaquine, that's a pronunciation. And Atovaquine is another drug modified Primaquine one. That is actually a new drug with a longer half-life. Just remember Primaquine, that's enough for now. Primaquine is an anti-relapse agent. So that means if a patient has a hepatic stage of malarial parasite hidden, you can give Primaquine. But to treat malaria, this is not enough. Primaquine cannot deposit in the RBC enough. Therefore, erythrocytic stages can be treated with other malarial drugs, and then you give a relapse agent, that will be Primaquine. Okay. Then another point, if a patient is pregnant, Primaquine is contraindicated in pregnant patients. Therefore, you need to wait until after the delivery, and you treat the malaria, of course, earlier, and then wait until the delivery and then give the Primaquine. Okay, so I'll talk about that details in few minutes. Okay, so we treated the patients. Indication you understood. When not to treat, contraindications, when not to use these drugs, right? So chloroquine, one thing to remember is this drug can deposit in melanocytes, right? Melanin pigment. It can bind to melanin. Therefore, if a patient coming with a dermatitis or psoriasis, if a patient already has a risk of history of dermal diseases, do not give chloroquine. Then Mefloquine is an drug which is highly lipophilic. Therefore, if a patient has any history of neurological symptoms like a psychiatric illness or a depression or seizure, do not give Mefloquine. Okay, so then a doxycycline, you know that it is contraindicated in pregnancy. Long-term prescription is not advised in pregnancy and also children under 8, right? Then Primaquine, I mentioned that Primaquine is contraindicated in pregnancy, and also major point, Primaquine is also contraindicated in G6PD deficient patient. I'm going to explain that in detail in later, but keep in mind Primaquine can damage the RBC, but if a patient already has G6PD glucose 6-phosphate dehydrogenase, it can avoid all the oxidative stress, right? But if a patient born with a G6PD deficiency, this normal stress to the erythrocytes will not be handled. But if it is adding Primaquine give more oxidative stress. Therefore, this can cause hemolytic anemia in patients. To prevent that, you should avoid in patients with a G6PD deficiency. This is the major reason you should avoid in pregnant patient. Reason, you can predict the G6PD status of a pregnant patient, but you cannot predict the fetus stage, right? So therefore, to save the fetus, you should avoid Primaquine during pregnancy. Okay, the next is mechanism of action, how these drugs works, right? So easy to remember. To understand, chloroquine, Mefloquine, Quinine, Primaquine and lumefantrine, these all are derived from cinchona plant. Therefore, this has more or less similar mechanism, but Primaquine has an entirely different molecular formula. Therefore, it has a different mechanism of action. Actually, this chop down all the membrane of the parasites and also the DNA. That's a unique mechanism by which Primaquine work. But chloroquine, Mefloquine, and Quinine and lumefantrine work similarly. So one of the most commonly asked mechanism of action question is in this section. So most of the time they asked about chloroquine, Mefloquine or Quinine, how these drugs work. Okay, easy to understand. Listen. So malarial parasites like to feed hemoglobin. Once they eat all the globin protein, they start accumulating a lot of heme. They don't like heme. In the parasite, they have special enzyme called heme polymerase. They convert heme to hemozoin. Hemozoin is non-toxic to the parasite, but it is toxic to us. That's the reason when they break out into the bloodstream, we get fever and other complication of malaria. Malarial diseases because of this parasite's hemozoin toxicity. But this is the normal story. But when we give these drugs, chloroquine or any of these drugs started to accumulate in the food vacuole. Once it start accumulating in the acidic food vacuole of the parasite, this chloroquine start binding on the heme polymerase enzyme of the parasite. And also it start binding to the heme also. Anyway, this is going to completely inhibit the conversion of heme to hemozoin. That means it inhibits heme polymerization. That is why this is going to increase the toxicity of heme. Heme start accumulating in the parasite, therefore the parasite will die. This is the mechanism of these drugs. So remember, chloroquine work by this mechanism by increasing the heme toxicity. This will kill the parasite. But let's look at the artesunate. This is a entirely different component, plant derived component. This is actually an alkylating agent. Why is it fast acting? Because it started accumulating in the food vacuole of the parasite, but it started, as soon as it bind, it's going to bind all the DNA and start chopping the DNA. Therefore, it will kill the parasite. So all the artemisinin derived products, for instance, it is a derivative called artemether, another drug, right? Artemether also work by alkylation of the parasite DNA. Okay, very good. But Atovaquine-proguanil, these have entirely different mechanism. Atovaquine, this is actually a ubiquinone derivative or analog. Therefore, easy to remember, this is going to attack the mitochondria of the parasite. Easy to remember, ATP synthesis inhibition in parasite. Therefore, Atovaquone inhibit the ATP synthesis of the parasite, proguanil inhibit the DNA synthesis. Both work together to make sure the parasite going to be blocked. But the problem is there's a lot of resistance. That is the reason Atovaquine-proguanil is not the go-to drug for most of this nowadays. So keep in mind, still prescribing, but there is a lot of resistance still there. But next, I was talking about doxycycline. You will never prescribe to treat as individual drug to treat malaria. Of course, you can give with a combination with other drugs, but disease treatment is not effective. What is the reason? This is a slow acting drug. What is the mechanism? Mechanism is protein synthesis inhibition. Protein synthesis needs time. This take a long time. That's a reason. Okay, so but remember the mechanism. Then next is pharmacokinetics. What are the three pharmacokinetics I want you to remember from all the antimalarial drugs? Most commonly asked board question. So chloroquine has an affinity to melanin. Therefore, it deposits in the melanin pigmented cells. This is associated with the adverse effect of this drug. We will discuss. Mefloquine is a highly lipophilic drug. Therefore, it can easily pass through the blood-brain barrier and start accumulating in the neurons also. Therefore, it has associated with a neurological adverse effect. Therefore, remember the pharmacokinetics. Then you have another pharmacokinetics to remember is doxycycline has a tendency to accumulate in your in your skin cells. It is your I forgot the name. The keratinocyte, sorry. So keratinocyte deposit, therefore, when it is exposed to sunlight, you can get adverse effects. So anyway, these are associated with the pharmacokinetics. One more pharmacokinetics, Primaquine. Primaquine has a tendency to activate in specific enzyme in human cells. That is also associated with one of its adverse effects. Okay, we will discuss in the next section. Okay, last one is adverse effects. So chloroquine, like I said, chloroquine has a tendency to accumulate in the melanin containing pigment. Therefore, common adverse effect of chloroquine is pruritus or skin itching. This is very highly noticed in dark skin individuals because of a lot of melanin. Remember, chloroquine causes skin itching. Okay, but what is the irreversible or a very highly, like a very serious adverse effect? Because chloroquine has two serious adverse effects. Those are associated with the accumulation in the melanin of eyes, that is in the retina, and also a tendency to accumulate in the cochlea. Cochlea has melanin pigments also. Anyway, so these two can cause the adverse effects of ototoxicity in chloroquine, induced ototoxicity, and also retinopathy. So these two are very serious adverse effects related to chloroquine, especially if you give high dose in long term, patients can get this adverse effect. Otherwise, it is a well tolerated adverse effect. But for the board, remember that adverse effect. Mefloquine, major adverse effects is if a patient already has seizure risk or any other history of neurological symptoms, you should avoid Mefloquine. This is a very highly lipophilic drug. Therefore, it can cause neurological symptom and nightmares. That is a most commonly patient reported adverse effect. And also hypnosis or all kind of psychiatric illness can be because of Mefloquine. It's short-lived, but can remember that. Then quinine is a strong drug and it is very toxic. Therefore, this is associated with a synchronism. This is associated with a nausea, vomiting, and a tinnitus, like a hearing impairment. All these are because of that toxicity. And also, because it is given in patients with a serious illness, the patient, remember, this is not an outpatient drug, or it is an IV drug, right? It is not a prophylactic agent either. So this drug actually can cause black water fever and also associated renal failure. What does that mean? Because as soon as you give quinine, this is going to chop all the parasites in the RBCs. Therefore, the infected RBC is going to break down and release into our blood. This is going to be, our blood will be completely contaminated with all the hemosoin and the hemoglobin products. Therefore, our kidney is going to be very much burdened. This is called, the urine will be very much dark red, Coca-Cola urine will be there, but also sometimes patients can get renal failure because our kidney is supposed to filter everything, it can block, okay? Then Primaquine adverse effect, there are major adverse effect is hemolytic anemia or hemolysis. Anybody can get hemolysis because Primaquine, mechanism when we talk about, this can easily get into liver cells. Similarly, it can also activate in the bone marrow cells. So the precursors of RBCs can also get attacked. So in the RBC, this is going to be activated and produce a lot of hydrogen peroxide. Therefore, it can cause hemolysis. Okay, remember that. And next, Atovaquine-proguanil. This drug combination causes only slight GI distress, slightly in some patients, and also doxycycline can cause GI distress, especially if you are prescribing to elderly patients. Keep in mind, this can cause GI distress. But phototoxicity, if a patient going to vacation and if they are exposing to a lot of sunlight, tell them to be careful and also try to avoid this prescribing this drug, because this is a daily drug. Sometimes patients don't like to take daily drug when they are going to vacation. Also, if it is exposed to sunlight because of depositing in the keratinocyte, exposing to UV light, it can cause phototoxicity. Keep in mind, okay? And last one, drug interaction. Doxycycline has a drug interaction. Tell them to not to use with a milk or calcium containing product because it will not absorb enough into the body, okay? Nothing else in this section, and this is it. Thank you. Next video will be antifungal agents, okay?